Hello, everybody. Thank you so much for joining us. We had a great first session and looking forward to this next session. I can't wait. Dr. Janice Nelson will be the moderator. She is a nursing director at UConn Health. She obtained her doctorate of nursing practice from the University of Connecticut with her dissertation entitled Sickle Cell Pain Management During the First 24 Hours of Inpatient Care compared to the National Heart, Lung, and Blood Institute Clinical Practice Guidelines for the Emergency Department, a quality improvement project. In 2022, she was a recipient of the National Sickle Cell Disease Association President's Award and the Dr. Peter J. Decker's Employee Appreciation Award. She was also a 2020 Nightingale Nursing Award recipient, one of Connecticut's highest recognition for nursing excellence. In 2016, she was awarded the Sojourner Truth Award from the SCDAA of Southern Connecticut for leadership in health inequity for individuals living with sickle cell disease. She was also one of the national SCDAA's iconic women in 2015. She has traveled to Nigeria to promote sickle cell disease awareness, approve disease management by distributing mosquito nets, and to assist with primary care for individuals living with sickle cell. She tirelessly works to improve overall care and management for individuals living with sickle cell on a local, national, and international level. I can't wait for this session, and thank you for agreeing to moderate this session. And I'll now turn it over.
Thank you very much for that generous welcome. So good afternoon, everyone. We want to welcome you to our Heal the Healers, a panel discussion by sickle cell healthcare providers on mental health and well-being. So I'll have each of our panelists to briefly introduce themselves, and then we'll get right into the discussion. So let's start with Pat, since you're first on my screen, and then we'll move to Charlene, and then we'll move to Trudy, and then lastly, we'll have Dr. Henry.
So how did I know that I was going to be number one to speak? So I'm Pat Corley, and I'm actually a retired nurse from one of the original sickle cell centers of excellence that were funded by the NIH. I am now currently doing advocacy work out in the community, education and advocacy in the state of California and wherever else that I'm invited to participate in events. It's been an honor and a pleasure. I've had the opportunity of meeting many individuals living with sickle cell disease and being able to embrace both them and their families. I'm looking forward to this panel discussion. I'm a little bit scared, but I'm hopeful that when we leave this discussion that things will be better for all of us, as well as for all of those individuals who are participating with us.
Thank you, Pat.
Hi, my name is Charlene Silvestre. I'm a nurse practitioner at Boston University, Boston Medical Center for Excellence in Sickle Cell Disease. I work primarily with the adult population. I have been involved as a nurse practitioner in family practice for many years, starting in 2003, but in 2015 was when I transitioned to sickle cell, and I feel very blessed to be allowed to take care of and to facilitate good outcomes for this patient population. It's really been my passion, and I am looking forward to hearing from my colleagues on this as well. Thank you.
Thank you, Charlene.
Hi, my name is Trudy Chum Johnson. I am a social worker at the Comprehensive Sickle Cell Center at Children's Hospital, Philadelphia. I also program manage our program, and also I handle newborn screening for our program. I have had the privilege of serving this community for 20 years now, going on 21. Definitely my passion. And I've had the opportunity to work with leaders in sickle cell disease that elevated how I think about serving this community each and every day. So I am excited to be here and support this conversation today. Thank you.
Thank you.
Hello, everyone. I'm Artangela Henry. I am a nurse practitioner with Methodist Labona Healthcare in Memphis, Tennessee. I have a history of making sure I take care of those with sickle cell disease. It is truly a passion, a privilege, and purpose for me to be able to do that in regards to advocacy, making sure that they have what they need from a clinical standpoint and even from a research standpoint as well. I am elated to be here with my colleagues to have this discussion. In regards to what Pat mentioned, you know, sometimes it could be a little scary when we're taking that deep dive into talking about these things in regards to mental health and what it looks like in racial tension sometimes that we may face within this disease process and profession, but I'm here for the discussion and I am so glad to be here with you all.
Thank you so very much. Dr. Vick, would you like to introduce yourself, please?
Hello, I'm Dr. Lori Vick. I'm a University of South Carolina professor of nursing, current president of ISCNAPA, and honored to be here. And so I'm really looking forward to the conversation. You all know that psych mental health is my area, so I really look forward to what we all have to share here. Thank you for allowing me to say hello.
Thank you. So without any further ado, we're going to jump right in. We're going to get right to the meat of it. So as a healthcare professional, especially a Black professional, what do you think or how do you feel about healthcare and its systemic racism and bias? How do you deal with that from a professional standpoint and from your patient standpoint? What kind of pointers, what do you think about that? Anybody can jump in and start off the conversation and we can just round robin it.
So I'm gonna jump in.
Oh.
I'm gonna jump in. And the first word I have to say is reality. That's the reality of being in the healthcare profession, period. But it's a bigger reality in being in the sickle cell space. And so I can remember even as a newcomer to the sickle cell space, I always felt like when I came to the unit to see people with sickle cell disease, that I was the most hated. I always came with purpose. And the purpose was to ensure that individuals living with sickle cell disease got the best possible care. And so I think that that it's always been very troubling to me, having to help individuals to navigate the sometimes hostile environment of the healthcare system. It was really, really challenging, you know, and as challenging as it was for me, I can't imagine how much more challenging it was for individuals living with sickle cell disease, and how even much more challenging it was prior to the, you know, for a long time, there were no nurses who really knew sickle cell. There were no nurses who really cared about people with sickle, muddy waters of sickle cell, even before we came into the space. And so I can only imagine how difficult it was for them. And it almost makes me want, you know, it makes me teary when I think about what they've gone through, because what they're still going through is above and beyond. So it's just been really difficult. it's been uplifting, you know, and as I see other nurses around me, like you guys, and social workers like Trudy, it makes my heart smile because I know that there is hope, you know, for people with sickle cell disease.
Thank you, sir. Thank you so much for that insight. Dr. Henry, you wanted to say something?
Yes, I think one of the biggest things I can say in regards to systemic racism in the profession and also within the disease process, to Pat's point, is the reality of it. But how do we address it? How do we tackle it head on? And so the important part of it is making sure that we understand it's aware. I think there's been a sense of awareness being glossed over, and we sometimes just put it behind us. And so what we have to do as professionals, and also to be able to teach our patients, is that we have to know that it's there. And so once we recognize that it's there, it's addressing it head on and making people accountable for understanding that certain microaggressions that they may say is not appropriate, whether it's within the profession or within a disease process. And that's the important thing. I think there has been a fear of really allowing people to know that you're making racist comments, or there's some systemic bias in how you're treating a particular population. And since we're talking about sickle cell disease today, specifically sickle cell disease, there's bias in saying that when they present to the emergency room that they're drug seeking. There's bias in saying that when they present, they're only looking for pain medicine. They have pain for a very specific reason, and it's our purpose to look and investigate to see what their reason is. And so just really bringing that to the forefront. And sometimes it's ugly. It's having those conversations that are extremely difficult to have.
I agree with you wholeheartedly. One of the things that I encounter frequently is the labeling of our patients as a sickler. That in itself brings a whole stigma and bias alone. So I take every time I hear that terminology to be an opportunity to educate that particular person that it is an individual who lives with sickle cell disease. They should not be labeled by their disease. And so once I take the time to educate them, they rethink it and they actually feel like, oh, well, I didn't mean to offend. I understand that you didn't mean to offend, but the terminology is offensive just the same. That's why we're having this discussion. And we need to be able to address those kinds of incidents when we see them in actual real time, so that it not only protects the patient, but it also protects their dignity, and it allows them to be engaged in their care in a more humane way. And so with that statement saying that it's protective of the patient, how many of you feel that you have to be the protector of your patient against systemic racism or bias? Trudy, you want to jump in there since you're the social worker? I know you deal with this quite a bit.
Yes. So what I wanted to say was, I believe a lot of things start at home, right? So I think that I absolutely think that some of the toughest conversations is just understanding, ensuring that your team, we're all on the same page about approach and about what's designed. My reality in this space is that my team members all have amazing strengths and weaknesses. And because we work so closely together, because we're all passionate about this work, we don't want to add to some of the biases that kind of push along some of this systemic challenges that our patients face in our institution. So some of the toughest conversations have just been recentering our team around how we show up and keep ourselves accountable of how we then affect maybe an outcome that a patient has. So I would say for sure, spending time with team to understand and make sure that you're all on the same page about anything thematically that may come up, and you're sharing cultural biases, because we're not all on the same page about that and what that looks like. But we all mean well at the same point too. And then, then you can go as a group, as a team, to address what's going on in your institution.
Thank you, Trudy. Charlene or Dr. Vic?
I've seen, I think in the short period of time I've been involved in sickle cell, and I say that because it's only been about 8 years. When I first came here, and what our organization is today has really changed dramatically. And the key to that has been education. When I first came here, I'm in hematology. This is the most common hematological genetic disease worldwide. And yet our patients weren't going in, allowed access to the infusion center for pain management. I mean, things like this. And we were just the ugly stepsister. We weren't on the hematology wards in the hospital. And so we've really changed that in many, many ways. We now have, we consult for our patients when we see them in the hospital. But the beauty of being able to be in both settings, inpatient and outpatient, is we're able to kind of follow our patients all the way through. And we did a tremendous amount of education, starting with nurses, because nurses on the hematology floor, I was amazed by the trainings that we did, how many came up to me afterwards and said, I never really understood that was what sickle cell was all about, because back in the day, that was the same floor that they would put on patients who had addiction issues and things like that. And so it was kind of lumped together in this amazingly biased, section. And so that education, it really started opening doors. I love you mentioning the term stickler, because it just makes my skin crawl. And it's just amazing how many people do that and don't think that's an issue. But it's like, no, that's not the sickler in 7B. That's, so-and-so, and this is what's going on here. And I think these things are really important for us to continue to reiterate, and you can call that protecting your patients, but it's also doing the right thing. And then we went on from there and provided a lot of education in our emergency departments and in general internal medicine. And so it's kind of taken on a life of itself, but you could never stop educating, because it's so important. And I think that this is really a good time to be in sickle cell, because there's finally some money for research. There's lots of visibility here where there never was before. And I think we need to capitalize on that for the sake of our patients.
I agree with you. Education is the lifeblood of making improvements for individuals who are living with sickle cell disease. Educating not only the patient and the provider in the systems in which they live and operate, educating the insurance company so that they will approve them to have access to their medications. It's all about education, because every time we have to write one of those letters of medical necessity, it is educating the person on the other end so that they now understand that you were withholding needed treatment from an individual. Pat, you had your hand up?
Yeah, I do have my hand up. One of the things I struggle with, I recently had a doctor who is really loves sickle cell, and she used the term sickler, but what really bothers me is, as you try to correct that, as you try to bring awareness to the term sickler and what it does as far as grouping everybody with sickle cell disease in a way where everybody's thought of it, as less than, or not having any value. But when you talk to some of the patients, and they will, as you're trying to correct folks, they'll say, oh, that it doesn't bother me for them to call me a sickler, which is concerning, because I think we have to do a lot of education with individuals living with sickle cell disease to say it's not all right to be called a sickler, because what that term means to you is that you have sickle cell disease, but what it means to others, it has a lot of negative connotations that are attached to it. And so we also need to educate to a level that people with sickle cell disease and the care that they receive.
Dr. Vick?
So I just think it's really, really important for us to realize that it's not just a professional, you know, a medical professional misstep, but our patient population also does the vulnerable position and allows people to look at them in a certain way as a group of people who all manifest in the very same way.
Yeah, it's the normalization of a negative term that we do all of the time. You know, some of the terms that we use calling each other, some people say, oh, that's a term of endearment. Well, it's really not, it's really negative, but we've normalized it. And so that's why some of our patients would feel like it's an acceptable terminology because it's sort of kind of gotten normalized over time. But as we continue to focus on educating all people around sickle cell disease, they too will understand, and maybe they will accept it or not accept it, that it has a negative connotation, but it's just a requirement of us to educate them that it has a negative connotation.
So one of the things, or three things that popped into my mind right away is that we are to be the change that we want to see in this world. So in order for us to do that,
Yes,
we need to model this, right? We need to model what is appropriate, what is, and speak to what is inappropriate. I work with a lot of student nurses that are preparing to go out in this profession. And so that is a conversation that we have from the very beginning, that, you know, you're there representing your profession. And when we are speaking with people, we need to give them the respect that they deserve, just like the respect that we want. So I'm always kind of teach those lessons. The other thing, when you were talking about this labeling stuff, I just thought, when is the last time you heard somebody say, oh, that's the heart failure? Or, you know what I mean? So it's a double dig to me when they do this to people with sickle cell disease, because it's not just they're labeling them with the disease, but they're also feeling at liberty to label them because of their background, ethnicity, and race. And if we just try to act like that's not real, it's not doing us any good, and it's not going to help us to really address some of these major racial issues. The other thing is giving people with sickle cell a voice. Never in my career have I heard from so many people with sickle cell disease. They're coming out, and we need to help them be elevated so that people hear their voices, know the marvelousness of them, and not just regard them as a person with a disease, but they are human beings that have great lives and so much promise. But they have an illness and they need some help with this, and that's our role. So, okay, that's where I stand on those issues.
Thank you, Dr. Vick. So now I'm going to ask an even tougher question. Given the discussion that we've just had, how do you stay unbiased? Does that add to your anxiety or stress? How do you continue to keep your focus? And so how do you keep the other stuff and the other people from spilling onto you? Go ahead, Dr. Henry.
I would have to say that I first have to start the day off realizing that, number one, I'm human. I can have my own opinions about certain things, but at the same time, I want to make sure that I treat people the way I want to be treated. I want to make sure that I treat people the way I want them to treat my family members. And it's all about dignity and respect. And so that's really easy. And it's hard for me to understand how people get away from dignity and respect of any human being. And so we're not far from being in the same position of having sickle cell disease when you look at the statistics, or even knowing that the statistics may be skewed. It may not be what we think they are. we're just as close to having the disease process that can put us in a position where we are crippled sometimes in pain, not only physically, but mentally and emotionally. And so how would I want someone to treat me? And that's where the advocacy piece comes in. That's where I have the ability to stand up and say, this is what they're going through. Let's talk about, let's break it down. Let's give you the knowledge base behind it. Talk about the pathophysiology of it, and then the socioeconomic status behind it and why it looks the way it looks, and put yourself in that particular situation or in those shoes as much as possible. But at the end of the day, it's dignity and it's respect. And so the question is, why are we not being respected?
That's a great perspective. Thank you very much. Does anybody else want to make a comment?
So I just want to make a comment. You know, I feel incredibly blessed to be allowed in the space of working and caring for people with sickle cell disease. You know, the word says the least of us. And so this is a population that gets the worst possible everything. They get the leftovers on everything. And so for me, you know, I always tell people I grew up in a family of 10 children. So I learned how to fight early. And with learning how to fight early, I learned the importance of respecting other people's spaces. I learned the importance of valuing everyone, you know. And so coming into this community, I came from where Dr. Vick is. I was a mental health nurse when I came in. And I tell the story all the time that I got tricked into sickle cell because I didn't know nothing about sickle cell. I knew nothing about people who experienced sickle cell. I had many classmates who had sickle cell. I didn't even know they had it. They didn't share it. You know, we went all through school, you know, and one summer, one of them died and did not return to school. And I was like, what happened to Jackie? And they were like, she died. She had sickle cell. And I still didn't know what sickle cell was. And so being in this community has taught me a lot of things. It's taught me the value of others. You know, whether you're a well person up walking around, whether you're a person who's going through mental health issues, whether you're a person who has sickle cell disease, everyone has value. And so it's living in this community has been a positive for me because it's helped me grow, but it's also helped me to take time sometimes. Sometimes I just say, you know, I can't do this right now. I need some time to just, you know, I just need a pause. And I will just take a pause for a little bit. I'll do puzzles, you know, because I love jigsaw puzzles. You know, I'll just get away to an area where it's secluded, you know, and I just have time to think about, you know, what's going on with me and think about, you know, my value to both me and to others, and to think about what I can do to soothe whatever is going on with me so that I can be the best me when I return to the setting that I know I'm going back to. So there are a lot of things that you know, people have different coping skills, you know, but I just look around me and I see how blessed I am, and seeing how blessed I am makes me want to ensure that other people have the same opportunities.
Sorry.
Enjoy life to what status you have in life. So I'm just incredibly thankful and feel incredibly blessed to be in the sickle cell population and feel incredibly elevated by this population and the value that they have, that I have for them, and the value they have for me, and the purpose that I have as a result of being a part of this community.
Thank you.
I just want to piggyback on that a little bit because it brought up a few things for me. So, you know, before I was a nurse, I was an MSW, and God bless you for being a social worker, because, you know, I feel like I chose the easier path by going into nursing, because I really think that that's such a challenging field, but I learned so much about it. And this is again why I think it's such a good fit for me working with this patient population, because I really believe in the whole person, and I really believe in respecting that and recognizing what's unique about all of our patients. And I think at times, when things get a little crazy or things get a little stressful, it's easy to kind of lose your perspective sometimes with this patient population, because you're so attached to these patients. I mean, that they're family, and that, you know, they when I first came here, you know, there was a lot of mistrust, and there had been one hematologist who'd been here forever, and really they just really loved her, well known to her. And so it took me time to gain that trust. And I'm happy to say that I have amazing trusting relationships with this patient population. And that is just so huge because they have been through so much trauma. But I think sometimes too, when we see our patients are at risk and things like this, it's kind of sometimes difficult to kind of separate ourselves, or we ask ourselves, what could I have done better? How could I have made this happen? And it's easy to get kind of caught up in that. So I think really self-reflection is so important, because when I hear myself getting like that, I need to stop and I need to pull back. So what Pat is saying about taking that time and refocusing and having something else to, you know, and not taking this home with you as much. It's very, very difficult to do, and that's a very hard limit to set, but it makes me a better provider to be able to do that. And I really think that's important in maintaining good relationships with our patients.
I just wanted to add to that. I think for this, I think to do this work and to like also stay unbiased about doing this work, you really need access to educational sources that deepen your intelligence around this work. I can't imagine who I would have been if I didn't land where I landed and with the individuals that landed. And that's the clinical providers, the nurses, powerful nurses who help support foundational work in this community. Powerful providers who supported foundational work. And I absolutely know that that's a privilege that I've had that maybe not everyone in this community has had direct access to. Because of that foundational education, it then led to experiences where I was able to develop wisdom. And to do this work and to really like support the navigation of the things that our patients will see, you have to be prepared to like see all aspects of how things can come at you in order to stay as grounded as you can be every day. Every single day, you have to be able to proactively see, okay, we have new disease modifying therapies coming our way. This is what we're going to see from insurance companies. So what tools do we need to develop ahead of time so that we are not feeling overwhelmed when things drop and you're trying to support patient care needs, but this also has the same equal attention that needs to be paid to it. So I think, like, I definitely feel like forums, spaces like this particular group are spaces where people should just get in the habit of tapping into as routinely as possible, just to bolster up what wisdom looks like for you, so that your ability to stay unbiased is better. It's just better because you have access to more resources.
Thank you.
Thank you so much, Trudy. I will just segue off of what she shared.
Okay.
I absolutely agree. I had someone ask me the other day, well, it was a group of students that came up to me and said, do you think all this training is really doing anything? Is it really worth it? I said, oh, absolutely. And let me tell you why. when I worked with a group of colleagues in a state psychiatric hospital, and there was some obvious racism that was happening in the workspace. And we all had to go through this training to communicate about what was inappropriate in the workspace, right? I had people after the fact, after this very intensive training, come up to me and said things like, I always considered myself a Christian woman. I didn't realize what I was saying and how I was coming across to other people. And I didn't ever open my head to think about how I might be communicating bias to people that were overweight. They were attacking people because of their weight and making them uncomfortable in the workspace. People that were Black or other races, they didn't realize. And yet this opportunity for frank conversation about what was appropriate and inappropriate in terms of communicating among your peers in that work environment opened their eyes to that. So if it just helps one person, yay. You know, we change them one step at a time, one person at a time. So and honestly, that was such a powerful mandatory training, if you will, some of those things that we do every year that we have to as a part of our work. It changed the lives of many of us. So I would just say that education and that kind of, it renews your spirit. It was a way, I mean, we were pulled away from work. We were in a different environment. They made it a pleasant environment. That was kind of a respite for us in our day-to-day, but also come together, become wiser, think about what we mean as a team, and all of that was a part of that supportive training. So just wanted to share that with you.
Thank you, Dr. Vick. I think it's important for us to be able to share information in a safe environment, because oftentimes people want to share, but they don't feel safe to be able to share. So we have to create the opportunities that they feel safe so that we can make improvement and changes in care. So with that, we're going to switch and talk a little bit about compassion fatigue. So we all understand that because we give and we give and we give so much of ourselves, sometimes we don't have enough left over. You know, our cup can run over, but if we don't keep something in the cup, we don't have anything left to give. And so let's talk about how we as providers, how do you address job fatigue? When is it too much? And how do you know that you need to take a break? And what do you do to help get yourself back to a place where you feel replenished, where you can now give again?
So I'm gonna say, what I've learned over the years is I don't feel guilty about getting in that place. You know, I give myself grace enough to realize that I can't be all things to all people at all times. And so sometimes it's just having some private time to myself. You know, sometimes it's being able to tell people I'm tired right now. I can't do that right now. I'll get back with you when I'm back there again, you know. But just giving yourself grace. I think we in the sickle cell community, we think we have to work so hard, and there's so much work to be done, but it doesn't have to be done in a given period of time. It's got to be done over time. And so I think we just have to learn how to say, you know, I'm really tired today. This is not something I can do today. You know, if I wait till tomorrow, I can do it better tomorrow. You know, and just to, you know, just to approve of I need to be by myself that day. And I will just take that time, you know, and because I need to think about some things and I'm not thinking right that day. So I have some judgment going on about something that's going on that I can't really process. And so I just think just grace, giving yourself grace, giving yourself, finding out what works for you. sometimes just going someplace where you can laugh and talk to other folks and not talk about what you do or talk about who you are, or, any of those kind of things is really, really helpful for me. Sometimes just going and getting some ice cream, or just finding something that makes me feel deserving and makes me feel better and makes me feel like you've worked hard, but now you can't continue to work hard if you don't refill. You can't dip water from an empty well, and take care of, what it take, because we feel like we're the savers of everybody, and sometimes we got to be the savers of ourselves, and our family. And so we have to give ourselves grace.
Thank you, Ms. Pat.
I just wanted to share in our setting, we have recognized that we're horrible at taking the time that we need to take. And we've also seen when we don't, how it shows up. So we're the first ones amongst each other to encourage taking some time off. But what we've noticed is that we've also had to create processes and workflows so that an individual taking that time off knows the work will get done. Some of the challenges have been, because we're a relatively small team, putting too much on your colleague. So then you end up not taking the time that you need to take off. So it really has encouraged us to create a workflow that that's not a part of the equation, and people are more likely to take time to just replenish themselves.
Thank you.
I think the other part of this too is having a good mentorship relationship with a colleague too, because if you have that too, I mean, again, this one particular physician who has been here for some time is my go-to, and she's amazing because she'll kind of stop me in my tracks sometimes and say, listen, let's regroup here. Let's kind of think about what the priorities are. Let's take some of the load off, because it can get very easy to get caught up in that, even when you're really trying to set those boundaries for yourself. So checking in with that person is a really good thing, because sometimes I find myself getting very, frustrated over certain situations, and I've got to do this, and this, and she kind of is really, really brings me down and just kind of puts it in a perspective that's really helpful. And unfortunately, when stressors are starting to build up, we're our own worst enemy in terms of, we're trying to get on top of that hill and get over that hill, and we can't get there. And sometimes it just takes that somebody else to kind of say, okay, let's regroup and what's really important here. And because we can't take good care of folks without taking care of ourselves. That's absolutely true. We like Pat says, if the vessel's empty, we're in trouble.
So I'd just like to piggyback off of that, because I am a firm believer in self-care. And so for me, self-care is an important aspect of my everyday health. So I make sure I get regularly scheduled massages. I make sure that I go and I get my pedicure. It's simple things to do that are going to make sure that you feel better, that you are refilling your well. Whatever those things are, we need to encourage ourselves to do them regularly so that we can replenish ourselves, so that we can continue to give of ourselves. And so it's really important to just indulge in self-care. It is not wrong to put yourself first, but we always put ourselves last. And because we put ourselves last all the time, we don't necessarily have enough in the well so that we can continue to do well while we're trying to give. So I just wanted to throw that out there. Self-care, advocate for self-care. Yes, I am. Important aspect of my mental health so that I can continue to engage in patient care. I'm sorry, I just had to throw that out there. Who wants to join in next?
No, I just wanted to point out that I participate in a pet therapy program here, which is great for our patients, but it's better for me. So today I have my dog Nellie here.
Oh!
They just dropped her off to me after having her visit healthcare for the homeless. But I mean, it's things like this that I can bring her once a week that bring me down.
Absolutely. It is
That and not
important to
taking things home.
recognize it.
You know, trying not to take things home. And that was a hard lesson for me to learn too, because, you know, I know a lot of times when I try to leave a lot of that stress at work. You know, I try to have a transition period. While I'm on my way home, because I take public transportation, so I don't focus on work things. I lied that yes, I do in the morning, get on Epic and on my phone, but you know, to see what's coming up. But on the way home, I really try to decompress that way. And you're right, self-care is so important. You know, I like to work out afterwards. That just helps kind of bring me down and it helps me regroup. So when I go home, I'm not doing what I've done in the past, which is, oh my God, I had this situation at work. I have really, it's taken me time to get to that point, but leaving this at work, even though these are people and relationships, is something that you really need to be able to set some boundaries with.
Absolutely. Absolutely. Dr. Henry?
Yes. Just listening to all of the comments, you know, everything that has been said so far really is a big umbrella of some of the things that we should do as healthcare providers. But I can't sit here and not think about, you know, the superwoman syndrome that we have as female professionals and what that looks like. And the fact that we need to take our capes off and send them to the cleaners for sure. It's time to be able to have that respite to really think about things. And so most times we always talk about work-life balance, but I think we need to shift the narrative and talk more about life-work balance. And when we do that, we are putting those things that are important to us first, so we are able to give to others and pour from a cup that is not half full or empty. And I would have to be very transparent in saying that I pour from a cup that was dry, and what that looks like. You know, how can you be all to everyone and you don't have much left for yourself? And so really tackling the reality of trying to be all for everyone. And then really thinking about self-care is not the same for everyone. It's not a one size fit all. And so most times when we hear people talk about self-care, we do hear, you know, massages and pedicures, and that's Dr. Nelson, phenomenal. Those are some of the things that I love too. But then we have to think about, what about those situations where that's not feasible or you can't get to the place? So what are those things that can emotionally impact you for you to be able to get the things that you need? And so all that goes back to is self-reflection. I think we work so much and so hard that we forget who we are as individuals, and having that time to just pause and think about who we are and some of the things that we like is also very refreshing, because we have an opportunity to seek new opportunities to give us the boost that we need. So there are so many different ways to pour into ourselves. But I also think someone mentioned mentorship, having someone else to pour into you. That's very important, because if we're constantly pouring out, how much do we have to give back to ourselves? And so making sure you have a circle of people who can also pour into you, and just having reciprocity in that sense. And the last statement I will make is that I have a motto that no is a complete statement, and I go by that. But the reality is, it's hard sometimes for me to tell myself no. And a lot of times I have to say, no, I'm not available. Or no, I can't, you know, be the person to be able to help you through this process at this time. Maybe we can check back in later, or I can redirect you to someone who can help you at this time. But no is a complete statement, and we have to learn how to be able to deliver no in a very pleasant and professional way, but very matter-of-factly as well.
Absolutely. I agree with you wholeheartedly. No, definitely is a complete sentence. And you don't need to explain. Sometimes you just need to say no, and then it's okay to turn around and walk away because you weren't being disrespectful. And so we have to allow ourselves to feel comfortable with that no when we give it, because oftentimes when we say no, we feel like we need to explain, wait, let me, no, just say no, and then you can keep it moving and you can move on and do what you need to do. I agree with you wholeheartedly.
So I do that. I respectfully refuse to do some things, but you have to do that and staying aligned with moving forward in your own life. There are days when you come into the office and do that, okay, and it's okay to say that, but I'll get back with you. But I think a lot of times in the sickle cell, it's so few people doing the job that you really get focused on making sure it gets done, and you look past what your needs are, and it's like Artangela said, we need to learn how to reverse those roles that we often, that we often go by. We often do things that we know that on that given day, we're not equipped to do it, but because nobody else can do it in our eyesight, there's always somebody else who can do what we think we're doing. And I think we have to just remind ourselves that it's bigger than just us.
Absolutely, absolutely. Any other comments? So now we're gonna focus a little bit different again. So we're gonna talk about depression, mental health. So let me ask you this. Do you think that nurses or other healthcare professionals as a whole practice what we preach? And do we often be able to figure out for ourselves when we need professional help for our stressful events?
I know there have been times where somebody else had to tell me that, because I was just on get it done, or do this, or this has to be done. And someone had to say, you look really tired. You look like you need to take some time off. It just doesn't seem like your normal self. We're just moving so much that we don't take time to really realize that we do need some mental health counseling, or we may need to sit with a like-minded person who can help us to get through something that we're experiencing, and I think a lot of times we miss those cues, and we need people who surround us who are able to say to us, it's okay for you to take this time and go and get what you need, because when you come back, you're going to be better at what you were doing when you left.
There's still so much bias and stigma associated with mental health that when professionals have issues with their mental health, it is difficult for them to think about navigating that issue. And I think it would be a false statement for me to think or to say that because we're professional nurses or we're professional social workers, that we're taking care of our health. When I think about people that have other illnesses, like people with sickle cell disease, and if they have a mental health issue, who do they go to? It's so hard to have trust to begin with. Are you going to open up about your deep inner feelings when you're having trouble just managing your day-to-day? So I'm always mindful about what's happening with people with sickle cell disease and whether their mental health needs are being addressed. I know you ask us about healthcare providers. I think we have our own issues because of our professional status, and we're not really, I mean, that's why people, I think, experience the compassion fatigue. I think that's why they have this imbalance in their work and life, because they're not able to develop that trusting relationship with someone where they can share what their issues are and to seek the support that they need. That's just my thoughts. Also, I've got research to look at that as well.
Thank you. Thank you.
I just wanted to quickly add, just from a social work perspective, in order to do the work we do, we have to seek mentorship. We have to seek therapeutic resources to be well in what we see and what we do, particularly the things that we actually can't change or do anything about. And it sits with us. I am appreciative of more healthcare institutions really launching intentional health and wellness initiatives to make us stop. You know, sometimes I don't realize how did the mindfulness moment invite get onto my calendar, but I appreciate it because when I see it, even if I don't get to join it, it reminds me to stop and create what that looks like for me. But I think it's essential for us to be intentional to at least participate that way, because we are still post-pandemic. That did a number. There's clearly a lot of trauma associated not only for our patients and families, but for our teams, you know, loss of providers through retirement or other opportunities to ensure their wellness or death. And then their whole rebuilding of who we are post that I think we're just all kind of getting to where it should be ideally now, but just honoring the fact that we've never all gone through a pandemic. And it has increased the type of referrals that we've needed to obtain therapeutically for our patient population, and then the recognition that it doesn't exist, or the wait list that they have to incur to get something that's essential. And also recognizing that for some of us, you know, we're on the same wait list. So I just wanted to put that out there too, just for consideration, and encouraging people to seek what you have access to keep you well through the day, through your institutions and so forth.
This has been fantastic.